So let's further look into the four-chambered heart. I know our heart doesn't really look like this, but just pretend that it does. All right, so basically, we need to figure out which one's the right side and which one's the left side. So just assume that you're putting the paper on you, and your right side would end up being this side, and your left side will end up being this side. Okay, so this is going to be the right atrium, and this is going to be the right ventricle. This side is going to be the left atrium and then the left ventricle. So just kind of try to burn that in your head, okay? Good. All right, again, we have, this is the lungs and this is the body. And what happens is blood will, so oxygenated blood will come out of the lungs. It will go through the left atrium, through the valves, and out to the body through a blood vessel. Okay, and then deoxygenated blood from the body is going to go into the blood vessel, to the right atrium, through the valves, and out through another chamber and blood vessel and back to the lungs. So now let's try to name all of these chambers and blood vessels and whatnot. So first of all, we have to understand that this and this are actually going to be valves. These are called AV valves. Okay, AV stands for Atrioventricular Valves. So this is basically there to prevent backflow. So it prevents backflow. So when the heart starts to pump, it will start pumping from bottom up, kind of like as if you're squeezing your toothpaste from the bottom up. You know sometimes how people like squeeze their toothpaste from the center? I hate that. But so to maximize your pumping or maximize your toothpaste, you want to pump from the bottom up, right? So same idea with the heart. You want to pump from the bottom up, and when you pump from bottom up, you don't want the blood to go back into the atrium, okay? And that's why we have the AV valves. A lot of times the AV valves can also be called the bicuspid valves. So that's just another way, bicuspid valves, another name that you can use, and it is interchangeably used. Okay? All right. Now understand, there's a mnemonic. Okay, blood going away from the heart. Okay, it's the artery series. All right. So obviously, this right here is going to be an artery. This right here is going to be an artery. So this right one right here, you know, the right on the heart, okay, it is an artery, but it's going straight to the lungs. So we call this the pulmonary artery. Pulmonary just means of the lungs, okay? If you know Spanish, it'll make more sense because pulmón means lungs, but if you don't know Spanish, then just memorize it, right? Because what's another name to memorize for bio? All right, so now let's continue to this side. So basically, when we pump blood out to the body, this artery is actually the biggest artery in our body. It has a very special name. It's called the aorta. But just remember, guys, again, going away from the heart is the artery series. A must be memorized. Good? All right. Blood coming into the heart is the vein series. All right, so this is vein and that's also vein. Now again, coming from the body, it is the biggest vein in the blood vessels in the body, and so this is called the Vena Cava. Some people call it Vena Cava, some people call it Vena Cava, same difference. No big deal. All right. Now this one right here, okay, because it's bringing blood from the lungs, again, just like the pulmonary arteries, we actually call this the pulmonary vein. Okay, good. All right, there's one more thing that we need to go through. There is actually another valve right here where the pulmonary artery is at and the aorta is at. And again, that is just to prevent backflow. These are called the tricuspid valves, okay, tricuspid valves. And this is going to prevent backflow of blood going back into the heart when it's supposed to be squeezed out and go to the rest of the body. Good?